Contact tracing is one of the oldest, most tried and true methods in public health and epidemiology. It's a little like detective work, right? If you test positive for, say, coronavirus, and a bunch of people investigate, try to find out everyone you've been in contact with, and then get in contact with them and try to get them tested and try to stop the chain of transmission. And while other countries like South Korea have used it very effectively to suppress the virus, the Centers for Disease Control has left it up to state and local governments to implement their own programs. One place that is doing that with a degree of success is Paterson, New Jersey. It was featured in the New York Times today. It's a low-income city. It's got around 150,000 people. It's the second most densely populated place in the country behind New York City. And they started doing this at the beginning of the pandemic. Quote, when the first cases began to appear in Paterson in mid-March, the Board of Health added 24 employees who had been trained in communicable disease investigation last year to join their regular team of 2 disease detectives. Here to talk about what that city is doing is the mayor of Paterson, New Jersey, Andre Saya. Mr. Saya tested positive for coronavirus in the beginning of April. He has since recovered, and that is great news, and I'm so glad you're feeling better, Mayor. Can you tell us a little bit about what you did and what your Board of Health did as the disease started, as you thought about implementing some kind of contact tracing program in Paterson?
Thanks, Chris. It's an honor to be on. And I also want to start off by saying you have a fan club here in Paterson led by my business administrator, Kathleen Long, and her husband, Kevin. They watch you religiously.
That's awesome.
Second, I want to give credit to my public health officer, because last year he had the foresight to approach me and say, Mayor, we got to apply for this grant to build capacity within our communicable disease investigation team. And at first, I didn't really capture the importance, but he convinced me. We applied for the grant, we received it, and we built our what is now called the strike team from 2 to about 25. And as it stands now, we're at 60. So it's scalable depending upon the number of confirmed cases we have. We don't want to overburden this strike team. And these are mothers that are working individuals that are working around the clock to make sure that we slow the spread. And so I'm proud that we applied for that seminal grant so that we could have the bandwidth within our strike team.
So walk me through, has it worked, I guess is my question, because one thing that happened early on in a lot of places is even places with very, very developed, resource-rich public health departments like New York City, the number of cases just overwhelmed contact tracing at a certain point, right? Like the spike got so big, you couldn't track it. That's why we had all shelter in place. What has your experience in Paterson been like through the sort of trajectory of the curve?
We've been hit disproportionately. You said it earlier, we're the second most densely populated place in the country. New York City is first. So we have 150,000 residents shoehorned into about 8 square miles. And I can tell you, they're so meticulous. This is a painstaking process. So they stayed on top of these cases. You even have the public health officer involved in the tracing. And I can speak from experience because, as you stated earlier, I tested positive for COVID early in April, and I was traced and immediately isolated. Then he asked for a list of close contacts, and as a result, he quarantined all those contacts.
So you actually went through this. So your health folks, your strike team, you tested positive. They said to you, who are your contacts? They got in touch with those contacts and told those folks they needed to quarantine.
Yes, they did immediately. Most of them were my employees, so they quarantined them immediately.
And are you confident that this program has lowered the amount of infections and fatalities you would have otherwise had in your very densely populated city?
Chris, it could have been far worse. We have a chief data officer, and mid-March, we asked them to project how many confirmed cases we'd have by April 15th. His projection was 8,000. April 15th rolls around, we're at 2,500. So as you can see, it's a little over a quarter of his projection, and that is attributable to the yeoman's work that's being done by our strike team within the health department.
Now, there's a lot of talk in the CDC guidelines for reopening about for contact tracing. But I'm curious, are you in contact with the feds at all? Like, is the CDC helping your folks? Are you getting money from the federal government to sort of build out this program, or even to show other people how you're doing it?
Well, we are in constant contact with our Senator Bob Menendez and Senator Cory Booker. He was mentioned earlier. He's been helpful as well. And we're hoping that this latest iteration of relief will be adopted by the Senate and the House so that we could expand even further and obviously lessen the burden on our municipal budget because we are going to experience a significant loss of revenue.
But do you have any, is the CDC, it just seems to me there's a universe in which the CDC is in constant contact with your folks and giving them technical assistance or helping with questions they have or providing, is that the case, or is this just kind of the thing that you're doing in Paterson?
No, credit goes to the men and women who are part of the strike team who've taken it upon themselves to help us combat COVID-19.
Wow. A Paterson story. The mayor of Paterson, New Jersey, Andre Saya. I'm so glad that you have recovered, and it's impressive what you folks are doing out there. Thanks a lot and stay safe.
Thanks, Chris. You too.